Having an autoimmune disease such as asthma, irritable bowel syndrome, Crohn's disease, allergies, or certain skin conditions really isn't any fun, especially as a child. When you're supposed to be running around and exploring, maybe making a snowman or water ballooning someone's house, you're stuck in a hospital bed with varying amounts of pain. Luckily, it's not all grim for the seemingly lifelong struggle. Children enduring autoimmune diseases often achieve remission, a loss of symptoms for a prolonged or permanent amount of time, once development into adulthood takes place. That's right, it's as simple as waiting it out in many instances, particularly for rashes and asthmatics. To see why symptoms often disappear, it's important to get a feel for the mechanism behind autoimmune diseases. In an autoimmune disease, normal substances in the body are recognized as foreign, triggering an immune response accompanied by antibodies. The antibodies then initiate an all-out attack on the substance identified as foreign. Antibodies bind to the substance identified as foreign, marking them for destruction by bounty hunter-like white blood cells. More immune responses and white blood cells are produced, and if the substance identified as foreign is actually normal, consistently present in the body, the sensitivity could mean big trouble. Because the body even has specialized mast and basophil cells, which remember substances identified as foreign by antibodies, inflammatory agents like histamine, leukotrienes, and prostaglandins pour out of these mast and basophil cells, causing huge inflammation, the trademark symptom of autoimmune diseases. The result is constriction and mucus production in asthma, red rashes with food or skin allergies, and the discomfort and bowel autoimmunities. But the hopeful side is that the body's so-called adaptive immune system is just that, adaptive. Part of the process involves dendritic cells recognizing the harmlessness of normal substances or microbes, such as those found in food, dirt, and air, and then stopping T cells from producing antibodies against them, a process termed tolerance. In fact, a Swedish study found parents who simply sucked on their babies' pacifiers to clean them after falling to the floor reduced the risk of their babies developing asthma by 88%, eczema by 63%, and dramatically reduced food allergies versus parents who boiled the microbes off the pacifier. Further, most children with asthma lose their symptoms as adults. Amazing, right? Even puberty plays a role in worsening autoimmune symptoms. Stress and hormonal changes, which contribute to worse inflammation, as with acne, may accentuate discomfort. For example, TNF-alpha, a component of the immune system which contributes to inflammation and is targeted by certain Crohn's disease medications, becomes elevated in the blood with an immune response towards acne. Although genetic factors like functioning dendritic cells occasionally come into play, it's safe to say the intricate human machine has ways of coping with all sorts of conditions, and sometimes patience and natural habits have answers towards something as complex as autoimmune diseases.